Good morning and welcome to the Spring Medicaid Fair. My name is Talisha Hodge Thompson, and I'm the Interim Account General Manager and the Technical Director for Gainwell Technologies. And we are the physical agent for the Department of Community Health, who administers the Medicaid program in the state of Georgia. I am super excited about being here today. I want to discuss a few highlights, some upcoming training that we're going to have, introduce our wonderful, fabulous, outstanding provider reps, as well as go over some of the key metrics that we've accomplished since the last Medicaid Fair. So without further ado, I will go ahead and talk about the highlights. Many of you all know that we implemented the multi-factor authentication on 11/29 of 22, and we did a phased approach with the provider community. So what we've also done is we also implemented a new PHE enhancement that will be implemented on April 27th of 2023. We will be introducing an enhanced access to the web portal for agents and billing agents acting on behalf of payees. Agents and billing agents acting on behalf of payees will now perform functions that were previously only given to rendering provider accounts. The examples of that new access for agents and billing agents acting on behalf of payees will now include eligibility, prior authorization lookup and submission, claim submissions, and much, much more. Why is this change significant? It means that larger organizations that have many rendering providers can get the access they need just by granting the new access through the payee rather than having to grant access through each individual rendering provider. This can significantly reduce the effort in maintaining your user accounts and also supplement the MFA registrations. So we're going to also include a short document that has a quick reference guide on our web portal training page. And that document will be called the Payee Selection Quick Reference Guide. And you will be able to find some quick clues and hints that will help you with this new enhancement. The next highlight that I'd like to talk about is the end of continuous member enrollment notice. Beginning April 1st, 2023, all Georgia Medicaid and Peach Care for Kid members will undergo an eligibility redetermination. The purpose of the eligibility review is to determine if the member is still eligible for Medicaid or Peach Care for Kids coverage. This process will take approximately 14 months to complete. First date for redetermination may be any time between April 2023 and March 2024. Now, one of the things that I'll tell you is that the department has made many communication efforts to multiple entities, such as the provider community, the CMOs, as well as the members. They've held webinars, they've done banner messages, as well as sent out member notices as early as April 15th. The agency is so determined to make sure that the members are aware of all of the options that are available to them. They've also asked Gainwell Technologies to start sending over all redetermination dates to the CMOs so that we could have additional outreach to that member community. Department of Community Health want to make sure that the members understand and know all options available to them so that they can seek out guidance and direction to ensure that they don't lose the benefits that they so much may need in the future. So they've done all that they can to make sure that they're overly communicating to the members as well as to the providers to ensure that everybody is aware of what's happening with the end of continuous member enrollment. We're also going to have a session at the end of today. That's later at the end, and you will have additional information that you will be able to obtain there as well. Now, are you in need of assistance? Well, we're here to help. Many of you may not have seen your provider reps during the pandemic, but with the pandemic ending, we're going to start doing on-site visits once again. But I want to make sure that you understand who your provider rep is. I am sure that you have talked to them throughout the pandemic, but I want to make sure that you know who that person really is. It's also important that you know, because those provider reps are the key communicator for you, and they're that bridge between us and you. They're that bridge between Gainwell and the provider. They're that bridge between you and DCH. Why? Because they have that information that you need. They're there to answer your questions, your concerns. Any information that you need, they have that information for you. If they don't have it, they'll do the research. They have the resources available to them to provide that guidance for you. They're here for you. So make sure that you use them whenever you need them because they're here for you. So I'm going to introduce them to you right now. I'm going to ask that they come on camera as I call their names out, just so that you're made aware of who they really are. So starting with the territories, and then I'll talk about the region as well as the rep. Territory 1, Region North Georgia, Mercedes Liddell. Territory 2, Fulton, DeAndre Murray. Territory 3, Northeast Georgia, Carolyn Smith. Territory 4, Northwest Georgia, Tierra Johnson. Territory 5, Southeast Metro, Ebony Hill. Territory 6, Middle Georgia, Chantil Bradshaw. Territory 7, Augusta, Jessica Bowen. Territory 8, Southwest Georgia, Jill McCrary. Territory 9, Southeast Georgia, Kendall Telfair. Territory 10, South Georgia, Anitris Johnson. South, Hospital Rep, Janie Griffin Weaver. North, Hospital Rep, Sharita Bentley. And these are our provider field reps that are available to you. Moving on to our in-house reps. Chastity Barrett, Latanya Durden, Crystal Gordon, Haley Guyton, Brandon Stewart, Kaylin White. And these are our in-house support reps. Moving on to the statewide consultants, Sheree Daniels, Brenda Hewlett, Danny Williams. And these are our statewide consultants. Moving on to our provider enrollment CVO field reps, we have Darlene Barner, and she's with the South. And Auburn Woods Hawkins, she's with the North. And these are our provider enrollment CVO field reps. And now I must introduce our managers that work with these field reps each and every day. Sharona Strong is our provider relations supervisor. And our claims operations provider relations manager is Anita Hester. Thanks again, team, for being amazing. Again, providers, we are here to help. If you need us, please contact us. Again, we are that bridge for you, and we will seek to help and understand if you have concerns or questions. We are here to provide you with information, training, anything you need from us. We are here to help you. So please reach out to us in the time that you need assistance. Moving on to the training. So one of the things that's very, very important, DCH is key and keen on training for their providers. They want to make sure that everybody is knowledgeable and has the information that they need. Each month, a banner message is sent out by the Department of Community Health and Gainwell Technologies, inviting you to participate in 10 webinar scheduled sessions during the month. We encourage you to send your practice managers, your billing staff, your business associates, your billing and service agents that submit claims to attend these sessions. Why? Because there's key and important information that you need to know that's going to help you in your day-to-day operations while you're servicing the Medicaid recipients of Georgia. And we want to make sure that you have the most up-to-date information, which is why we provide these sessions for you. In May, we're going to have a nursing facility services webinar. In June, CCSP. In July, GAP services. In August, CIS. In September, now in CUMP. In November, physician services. And in December, hospital services. And then again, we will have another amazing Medicaid Fair just for you in October or November. Once we get the dates, we'll provide that information to everyone. But again, it'll be just filled with as much information as you're getting today. We'll have that information out for you again in the next Medicaid Fair as well. Now let's talk about some of the key metrics that we've accomplished at Gainwell Technologies during the time period from October 1st, 2022 through April 1st of 2023. The provider relations team has been extremely busy. Provider outreach has been 9,839 provider contacts. That includes emails, phone calls, virtual workshops, and virtual visits. As it relates to the provider service contact center, we've had over 655,803 calls. The web portal requests and written correspondence process, 5,963 requests. Provider enrollment is currently processing applications within 8 days of receipt. CVO is currently at 23 days within their 51-day SLA. We've received over 14,808 CVO applications and approved 9,291 CVO applications. As far as revalidation applications, we've received 11,378 applications and approved 10,754 applications. As it relates to resolution and adjustments, we are currently processing adjustments received within 1 day. We've processed 4,506 cash receipts and paper adjustments. Suspended claims reviewed and processed, 78,697. In data capture in the mailroom, the number of outgoing letters mailed, 2,705,325. The number of publications mailed, 72,000. And total claims data captured, 6,618. Now, that was a lot of information. And I know it can be overwhelming for some, but that's what we're here to do. We're here to help members. We're here to help providers. And so at the end of the day, we want to make sure that we're doing what's best for you, what's best for the Department of Community Health, what's best for the members. And so therefore, we're here to do the processing that you just saw on the previous slides. Here are a few reminders. This presentation will be uploaded within 2 weeks. So if there's some people that couldn't attend today, please feel free to share the link below presentation at the website listed here, mmis.georgia.gov. They can go to the provider information section and to the provider notices, and they'll be able to see the exact same presentation. We want to make sure that we don't miss anybody. We want to make sure that everybody gets the same information, even if they attend or not. So we will upload this presentation in the next 2 weeks, and it will be available to everyone. As far as some additional Medicaid resources available, as I mentioned earlier, the Department of Community Health sends out banner messages frequently, and we load them on our GAMA's website at the mmis.georgia.gov site. Please pay attention to those banner messages. The department has always wanted to make sure that you are up and current on the policies and procedures, the new programs, the mass adjustments that may be occurring. They want to make sure that you know first. They want to make sure that you have the most current information about the program that they are administering in the state of Georgia. So therefore, please pay attention to those banner messages. And as far as it relates to the DCH newsletter, please subscribe to that. That information is out there for you because they also have valuable information there. DCH is promoting a healthy Georgia. Healthy Georgia for the members, healthy Georgia for the overall community in this great state of Georgia. So again, I appreciate you all being here today. And I want to say that Gainwell Technologies and the Department of Community Health, always we're looking for ways to better improve the services that we provide, but we are always wanting to provide the quality services for our member community as well as our provider community. And we thank you so much. And now I want to turn it over to Lynette Rhodes, the Executive Director for the Department of Community Health. Lynette.
Thank you. And good morning, everyone. Welcome to the 2023 Spring Medicaid Fair. On behalf of Commissioner Kaylee Noggle, we welcome each of you and we thank you for your participation. Again, my name is Lynette Rhodes and I am the Executive Director for the Medical Assistance Plans Division with the Department of Community Health. We will start out today with a brief introduction of the Department of Community Health, who we are, what we do. We'll dive into some enrollment trends, talk about our current priorities, expenditures, and then just a summary again of our breakout sessions for today. As our starting point, for those of you who are new, or if this is your first time attending a Medicaid fair in the state of Georgia, the Department of Community Health is the single state agency that is charged with the administration of the Medicaid and Peach Care for Kids programs. We currently operate 2 service delivery models. We have a fee-for-service model and we have a managed care model. Currently, we have 3 managed care entities that serve our members. They are AmeriGroup, Peach State Health Plan, and CareSource. And you will hear from each of our health plans today. So I do hope that you have registered for those sessions and that you are able to attend. They have some really great information to share with you and some updates on current initiatives. While we are the single state agency designated to administer the Medicaid and Peach Care for Kids programs, we do not do this alone. We get a lot of help from our sister agencies. And so I wanted to take a moment just to acknowledge them and to inform our participants today of who those entities are. We work very closely with the Department of Behavioral Health and Developmental Disabilities. They are our behavioral health authority in the state of Georgia. We do lots of work with the Department of Public Health. We work with the Department of Education and actually just finished an initiative with them that I'll talk about momentarily. The Department of Juvenile Justice, the Division of Family and Children Services is another one of our sister agencies that we work very closely with. And then there is DCAL, the Department of Early Care and Learning. So we'll shift to talking about our current enrollment trends. So as many of you are aware, in March of 2020, the Secretary of the Department of Health and Human Services declared the public health emergency. Our enrollment at that time was 2.1 million members, and this was for both Medicaid and Peach Care for Kids. As you can see, over the past 3 years, our enrollment has increased significantly. As of March the 31st, we enrolled 2.8 million members. So we're talking about approximately 700,000 additional individuals who are receiving healthcare services through the Medicaid and Peach Care for Kids plan. The enrollment has increased significantly due to the fact that we were prohibited from disenrolling. We were prohibited from disenrolling any members during the public health emergency. So we have maintained on our rolls all of our Medicaid and Peach Care for Kids members with certain exceptions. Some of those exceptions would be someone who voluntarily disenrolled from the program, or someone who may have moved out of state, and of course, those individuals who are deceased. But aside from those very limited instances, all members have been maintained on the rolls, and then we've had those who have applied, so the new members as well. In terms of how that membership breaks out, approximately 600,000 of those individuals are being served through fee-for-service. These are aged, blind, and disabled individuals. And the remaining 2.1 million members are served through managed care. So these are going to be our low-income families, our children, our newborns, and our pregnant moms. So I want to shift to talking about our current priorities and what the department is working on today. So there are quite a few. The first that we're working on, and probably the one that you've heard the most about recently, is the start of the Medicaid and CHIP redeterminations. So that work began on April the 1st, and we'll talk about that in more detail in just a moment. We have several procurements that we're working through right now and new initiatives. We are very excited to announce that we will be kicking off our Pathways to Coverage 1115 waiver, which will serve to provide medical services to those individuals who would otherwise not qualify for Medicaid, and then preparing for the end of the public health emergency, which ends on May the 11th. So I want to spend a little time talking about our Medicaid and CHIP redeterminations. This is very, very important. Our federal partners issued a directive to all state Medicaid agencies that we end the continuous enrollment requirements. And so what this means for us in Georgia is that we are now going to have to go back and redetermine eligibility for all of the individuals who have been enrolled going back to March of 2020. So we have not completed any redeterminations on these individuals since that time. But now that the continuous enrollment requirements have ended, we are now mandated to do that review for all of our members. That process began in Georgia on April the 1st. It's important to note that not everyone will go through this process at the same time. This process will last approximately 14 months, and each one of our members has a specific month in which their eligibility redetermination is to take place. So the first month for redeterminations is the month of May. We are going to align those renewals with SNAP and TANF programs. So if we have a member who's also receiving services through either of those programs, we will align those redeterminations so that they take place at the same time. The first written notices are going to be issued to members or have been issued to members as of this week, actually. On Monday of this week, the first batch of notices were distributed to those individuals who were not auto-renewed. And we'll talk more about this process during the last session today, in which we will cover in more detail the Medicaid and CHIP redetermination process. It is important to note that the earliest termination date will be June of this year, and this is for members who receive a termination or denial notice. And just want to remind individuals that members will have a 90-day reconsideration period in which they can submit any additional information that the department needs to consider. And of course, all members who are denied will have appeal rights. I do want to encourage you to attend today's session on the end of the continuous enrollment requirements to get more information on how you as a provider can help with this process, as well as how you as a provider are impacted by the redetermination process. I do want to inform each of you today that we've established a website that has a lot of good information about the redetermination process. This website was designed for members and providers, and the website is staycovered.georgia.gov. Again, it's staycovered.georgia.gov. And if you log on to this website, you're going to find frequently asked questions. You will find provider and member toolkits. There are short videos that give information about the redetermination process and a list of resources. So we strongly encourage you to log on to this website to obtain additional information about the Medicaid redetermination process. I will now shift to updates on our procurements. We currently are working through 3 procurements, and all 3 of them are very large undertakings that we've started on, but we've got some great staff who are committed to the process. The first is our care management organization procurement. So as you may be aware, we issued a request for information back in June and July of last year to get and glean from our provider community and all interested parties what it is that you all would like to see in the next round of CMO contracts. And I am pleased to announce that the response to that RFI was overwhelming. And so we have taken all of that feedback that we received, and we are using that information to inform our next round of CMO contracts. So we continue to work through that process. We will continue to keep you updated, but this will be our CMO procurement for Georgia Families and Georgia Families 360. So just stay tuned for more updates. In addition to our CMO procurement, we are also working on our fee-for-service pharmacy benefit manager procurement. We're seeking to bring on board another PBM vendor. Currently today, we have Optum Technologies, and so we'll continue to work with them. And then we have our MMIS procurement, which is the mammoth probably of them all, in which we're going to be breaking out our MMIS system into various modules. So again, stay tuned for more information on each of these procurements. I will share with you that for the MMIS procurement, we will be reaching out to providers to get volunteers to help to do testing on the provider module that we will be standing up soon. So just stay tuned again for more information in terms of your participation in our testing efforts. We have a number of initiatives that we're working through that will help to improve access. And I want to talk about these a little bit today. The first is Certified Community Behavioral Health Centers. So this is an initiative that we're working on with the Department of Behavioral Health and Developmental Disabilities. As I mentioned in our introduction, we work very closely with DBHGD as they are our behavioral health authority in the state of Georgia. So the Certified Community Behavioral Health Centers will serve to expand access to mental health and substance use disorder services. Services will be expanded to be more comprehensive. Additional screenings will be provided, and we will do a good bit of this work through our community service boards that we have enrolled today. As you all are aware, there's been a significant emphasis and huge shift in focus on behavioral health in the state of Georgia. So this will be another way that we can help to expand services to our members who need assistance with mental health, behavioral health, or substance use disorder services. I am excited to announce that we have received approval from the Centers for Medicare and Medicaid Services to implement behavioral support services. So this service will allow us to place in the homes of our members in the community a behavioral support aide who will be there to assist with crisis stabilization, redirecting the member, evaluation, and helping to keep that member hopefully from being admitted to a PRTF, a psychiatric residential treatment facility, or it will serve as a step-down service for those members who are being discharged from a PRTF facility. So we are providing this service today. We encourage you as providers, if this falls within your wheelhouse, to enroll as a provider type. Our state plan amendment outlines and identifies the training that's required to be a behavioral support aide. So again, just want to encourage you to take a look at that to see if this is a service that is appropriate for your entity. And if so, we're hopeful that you will enroll. Through the use of behavioral support aides, we are hoping to stand up a therapeutic care model. This is something that we're working on today with both the Department of Behavioral Health and Developmental Disabilities and the Division of Family and Children Services. So this again is a new service that we will be standing up in the very near future that will provide additional supports to our children in the community. I've also identified here an initiative that we're working on with the Department of Education, and this goes towards the concerns around addressing the social determinants of health. So through our initiative with the Department of Education, we are providing information on those Medicaid members who would qualify for free or reduced school meals. And so I am super excited about this initiative. This will eliminate the need for the Department of Community Health, the Department of Education to have to reach out to members to obtain information on Medicaid eligibility. We will now work hand in hand with them to provide that information. And as you all are aware, social determinants of health play a major factor in terms of our members' health and their ability to access care. Finally, we are re-engaging on our Centering Pregnancy Incentive Program. This program is designed to assist our pregnant moms. It allows them to come together in group settings to discuss various issues, concerns, and receive counseling services to help them moving forward. This ultimately plays a part in reducing maternal mortality and morbidity. So again, this is a service that we are very excited to re-engage on. We are now working with Grady Hospital to roll this model out. So super excited, and we'll keep you all posted. Do want to touch upon our Pathways to Coverage 1115 waiver. We have a breakout session on that today that will be led by Anika Washington. So I do hope that you've registered for that session as well to get the information on pathways. So this waiver will allow individuals who otherwise would not qualify for Medicaid to receive services. Our implementation date is July the 1st, so literally just around the corner. This service will be available to individuals ages 19 to 64 who have incomes up to 100% of the federal poverty level. You must meet qualifying activities, which Anika will discuss today in her presentation, and the individual must opt in to the waiver. There is an intersection here with the end of the continuous enrollment requirements, and that we are hoping that this will serve as a safety net to catch some of those individuals who are no longer eligible for Medicaid. So we'll talk more about that in our breakout sessions today. Also want to touch upon the public health emergency and unwinding. So as a reminder, the public health emergency ends on May the 11th. Again, May the 11th. What does that mean to you as a provider? It means that a number of the waivers and flexibilities that we put in place will end. Again, a number and most of the waivers and flexibilities that we put in place will end. One of the flexibilities that we are going to keep in place is going to be the expansion of telehealth services. We've gotten a number of questions around telehealth and how we intend to proceed moving forward. So I just want to assure each of you that there will be very few changes as it relates to telehealth. This has served to increase access to our members. The response, again, has been overwhelmingly positive, and so I just want to assure you that that is not a concern that you should have at this point. I have listed for you here some of the flexibilities and waivers that will end on May the 11th. So we will begin and reinstitute provider revalidation requirements. So providers, you're going to have to log into the Gamma system and complete that revalidation process. And we will be reaching out to notify and remind you of each of you of that requirement. Site visits are going to resume. So our agents and assistants with Gainwell Technologies will start going out again, doing those site visits. Prior authorization requirements will resume. We relaxed those during the public health emergency, but just want to remind everyone that we are going to resume the prior authorization requirements. Application fees will be reinstated. Our PASSAR level 1 and level 2 assessments will resume, and the provision of services in alternative settings will end. And so I've gotten some questions about this one in terms of, well, what does that mean? So as you all will remember, at the start of the PHE, a number of our hospitals set up off-site locations to treat our members. And so what this is saying is that that will end and will no longer be allowed going forward. So again, we will be sure to remind and notify providers of all of these changes that will take place on May the 11th. In terms of our expenditures, we have not yet finalized our expenditures for state fiscal year 23. So just know that we will have more information on our expenditures for state fiscal year 23 at the fall Medicaid session. So I hope to see you there to get those updates. But in terms of state fiscal year 22, just wanted to share some information with you. So if you look at the area that is shaded in light blue, that represents our capitation payments. So as you can see there, we've paid our CMOs $5 billion in capitation payments during state fiscal year 2022. The other shaded areas represent the services and expenditures related to fee-for-service. So these are our waiver programs, our physician services, pharmacy services, nursing home services, hospital, and mental health. And again, those figures that are presented on the left side of the graph represent expenditures tied to our aged, blind, and disabled population. And this is specifically for Medicaid on this particular document. Next are our expenditures for state fiscal year 2022 that relate to Peach Care for Kids. The majority of our Peach Care for Kids members are served through managed care. So that's why you'll note here that the light blue shaded area represents the majority of the graph, and that's because our CMOs provide services to our Peach Care for Kids members. We do have a very tiny subset of Peach Care for Kids members who are served through fee-for-service, and as you can see at the top of the graph there, that represents those expenditures. So want to close us out by walking through today's breakout sessions. I hope you have registered for them and are able to attend. We have a lot of good information to share with you today. There's quite a bit that's going on at the department and within the Medicaid landscape. So at 9:50, we will kick off with CareSource, who is one of our newest care management organizations to the state of Georgia. Thereafter, we are going to take a very short break. We will then resume our presentations today with AmeriGroup, followed by Peach State Health Plan. We will then break for a 30-minute lunch. We will then come back and resume with a presentation from Anika Washington on our Georgia Pathways to Coverage 1115 waiver. We will then have a session on common denials, and we will close out with our Medicaid and CHIP redeterminations and providing more information on how it impacts you as a provider and how you can help with the process. So I hope that you join each of these sessions today. I hope that you find them informative. We look forward to receiving your feedback, so please be sure to respond to the surveys that you receive after today's sessions. And again, on behalf of our Commissioner Kaylee Noggle and myself, we thank you for your attendance and your participation in today's session. Thank you.